everyone, and welcome to the TAS Morning Show. On the occasion of the World Physical Therapy Day, our special guest for today is Dr. Prakash Babu, who is an orthopedic specialist at the AdLife Hospital. Let's hear from the doctor about the importance of physical therapy in our life. So welcome to the show, Dr. Prakash Babu. I'm so happy to have you here.
Yeah, thank you very much for asking me to give this questionnaire on behalf of World Physiotherapists Day of 2024. Thank you very much.
So on that note, I would like to know that what are major injuries that you get to treat in Oman? Like what are the injuries people come up with majorly?
Yeah, major injuries which I see in my practice is people, they just want to know about whether they had any fracture or not, but also most important is sprain and strain. Usually I see more ankle sprains and also the knee sprains. So, and also back sprain. It's very common in my practice.
Interesting. So in general, if a patient comes to you, I would like to know how do you structure your physical therapy sessions with them?
Yeah, as a orthopedician, if the patient comes to me, I first see whether the patient has any fracture, because bone is very important. It is the one thing which gives the stability frame of the body. If the bone is not broken and if the ligaments are not very badly uh, like sprained, or muscles were not very badly uh, strained and all, if he is stable enough, means I would like to treat them with the physiotherapy after giving an initial period of rest for about 15 days. So most of the sprains and strains we treat by after 15 days with active rehabilitation physiotherapy.
So doctor, well, in general, I would like to know how do we actually scientifically treat back pain? I think that's like a common thing that has been going on for a while now, right? Back pain.
Yeah, back pain, to start with, scientifically how we treat is, first of all we have to come to a diagnosis, not the full diagnosis, at least a conclusive diagnosis, like whether the muscles got strained, or disc prolapse, or in old people like osteoporosis, degenerative, what reason is making the back pain. That is the first step of our treatment diagnosis. Once we are through the diagnosis, that mainly done by physical examination and x-ray. Once the diagnosis is very clear, then we scientifically we can treat them. And most common cause for back pain in young people, young means less than 50 years old, in these days is obesity and bad posture. So nowadays everything is in fingertips. People, they don't have to walk for long distance, or they don't have to like strain their body, or grinding, mixing, like plucking fruits, climbing. Most of them, they don't do it at all, and they are actually forgetting. Olden days people, they used to involve in lot of recreational activities, like with the family members going outing and lot of things. But nowadays, because of the
Lifestyle.
work timings, lifestyles, they are confined to the room, confined to the system, and home is just like rest place. So most of the people, they are becoming obese, and they are in the position of looking into the system out of curiosity. Even at home they will be looking at the audiovisuals. So this makes the back to get more straight. That is the main reason for the backache nowadays.
Well, I would also like to know that what has been your best cases till today with some patient? Their recovery was absolutely flawless. Could you share an experience like that?
Yeah, I have a lot of experience
Share
even
anyone,
in
please.
Oman in the past 1 year also. Like many patients, they come with back pain, and they were not even aware that they got the back pain because of their obesity and bad posture. And when we just at the time of examining itself, we usually advise them to do some spine relaxation exercises. Once they do, immediately they will get relief. And they do take some medicines, and they do go to the physiotherapist, and at least for 4 or 5 sessions of physiotherapy itself, they will be free from the back pain. But that is the way of treating. And only some people, those who have, when the pain is not relieved, despite of doing all these things, at least for a period of 1 week, then we consider them as they definitely, they may be having some problem. That in these days it can be easily diagnosed by doing first X-ray. X-ray is very, very important in old people, like those who has osteoporosis, those who has degenerative spine. X-ray is the diagnosis. Many people, they think that they need MRI or this, that and all. But in X-ray we can easily find out osteoporosis, because the bone itself, it looks totally more blacker than, no calcium in the bones. And most of them, they are not exposing to the sunlight properly. In those, if you see the X-ray, definitely osteoporosis will be there, and spine will be bent to one side, and that we call scoliosis. So that is another side. Old people. Young people, most common cause of back pain is obesity and bad posture.
All right. So in that case, talking about young people, kids especially these days, are carrying heavy school bags, right? So could you share your thoughts on that? Because the heavy school bags also affect in posture. So could you share on that?
Yeah, actually, school bag is a shoulder bag. Okay, and see, however heavy it is, it cannot make the spine to bend forward. It will keep the spine backwards only. For some patients, we do even give the Tyler's brace. So the brace also looks similar to that bag only. If a school student who is so young, so muscular, so well nourished, carries little heavy school bag, means it is a good exercise. Usually osteoporosis comes when the bone won't get proper circulation. So I don't think that carrying a heavy school bag can cause backache in a normal, healthy uh, adolescent or kid.
That's interesting.
But the thing is, they should know how to keep it tight over the shoulders.
So lastly, any tips on treating bad posture? Because today's lifestyle, like we have already discussed, is like sitting on the computer, or maybe just driving cars for long distances, and not doing any physical activity. So any tips on that to treat bad posture?
Yeah, bad posture here in Oman, it's very common because most of the women are they are housewives. They will be in the house, and they always uh, think that if they look forward, and if they stand in front of men, or if they sit like this, it's a disrespect to others. And even the TV, whatever they arrange in a very lower position. So they will lean forward and try to look very enthusiastically, whatever it is. My best tip is whatever we have to see, we have to keep above our head, whether it is system, mobile, or little up. If we can put two hands up, then the spine will have very good posture, the weight distribution will be very good, and doing some sort of stretching exercise, spine extension exercises,
Could you show
that will
anything?
help.
Could you show any of your spine?
Yeah, see my posture,
Yeah.
my hands are supported, my back is supported. This is the best posture. But the culture, is like praying 5 times, leaning forward so many times, and what if the others see my foot, what they think. So these are the actual, and wearing covering the body all the time, not coming out from the house. These all the reasons for elderly women to get degenerative spine, osteomalacia, and like if most of the women, when I see the X-ray, there will be lot of osteoporosis. All the spine will be bent to one side, and another side they will be suffering a lot. And if we can educate and make them to come to the physiotherapy and explain them, the body weight is carried by the spine. More you lean forward, more your head weight, your visceral weight, everything, heart weight goes forward, and gradually they will develop kyphosis. That should not happen. They should be allowed to do some stretching exercises at home, and some freedom to sit, lean on their backs, and have TV. What most of the time they see only TV, so TV should be little above their head. Then that will definitely give the good posture, and exposing their body to sunlight, like early morning sunlight. These are the natural tips which gives very good posture to the spine.
Well, thank you so much for actually enlightening us on this World Physical Therapy Day. I'm so glad to know about all the tips, and I'm sure our viewers also must be really well informed about what exactly they should do in future to prevent osteoporosis or any other bone-related diseases. Thank you so much for being on the show. I'm so happy to have you here. Thank you.
Yeah, thank you very much.
Thank you. Thank you so much for watching the TAS Morning Show. For more updates like these, follow the Arabian Stories.